So I promised myself I wouldn't do any videos 9.5 months pregnant, but there's just one more thing that I really need to talk about, and that's prevention of diastasis. So this is where your ab muscles separate, and this can be kind of difficult to get back after pregnancy, so it's best to prevent it before it happens. So one of my favorite exercises in the whole world is pull-ups, but around 7.5 months, pull-ups started putting too much strain on the front of my belly. And I don't want my ab muscles to separate. I don't want to have to work to get them back. So the best way to prevent this issue is to take out anything that puts any front strain on your abs. And of course it makes sense, like sit-ups, crunches, even push-ups on the ground puts a lot of strain on the front of your abs. But it's also non-obvious things, like doing pull-ups, where you're pulling up and you tend to strain forward, and your abs just aren't what they used to be because they're really getting this giant stretch from your baby, right? Or maybe you're a postpartum woman and you're looking at healing. You need to think past those basic exercises to what puts a lot of strain on your stomach. Things like CrossFit, those kipping pull-ups, really put a lot of front abdominal strain. So one of my favorite exercises to do in place of doing a pull-up, where you can still get great back muscle strength, doesn't target your lats quite as much, but it targets those mid-back muscles, which are awesome for building great posture and great strength, is a horizontal pull-up. Now, what I want you to focus on for this exercise is getting your scapula, those shoulder blade muscles, to come together. All right, so if you see my back here, these scapula, you're gonna pinch them together for this exercise. What I don't want you to do is arch your back more and use the muscles that run up and down to do the exercise. Those are cheaters. We don't want them working. We want those nice scapula muscles to make you stronger, not make your back tighter. So what I'm gonna have you do is find something at a playground or a barbell at a CrossFit gym or whatever. You can put your feet up to make it a little easier. Make sure your back is nice and straight, chin is tucked, and you're gonna pinch your shoulder blades together, bringing your body up. What I don't want you to do is overarch your back, punch, or lead with your shoulders. Okay, obviously that looks terrible and you're not using the right muscles. Now, if you don't have a lot of confidence in your grip strength, please get somebody to spot you because I don't want to see you falling on the ground. All right, so give that a shot. It's a great exercise for building mid-back strength, and it's extremely safe for supporting diastasis and abdominal separation and helping to keep you strong while you heal.